Watch TV, promoting sustainable development.
Good evening, lovely viewers, and you are welcome to Health Moments, where we talk about everything health. This evening, we are bringing you another interesting but very educative topic. But before we go there, I want to say thank you all for viewing our previous posts. If you haven't seen them yet, I will encourage you to do so because there's a lot of information for you and for your health. Today, as usual, I'm your host, Dr. Araba Aso Odum, and I have with me a wonderful gentleman. He's also a doctor who works at the Efian Kwanta Regional Hospital in Takoradi. He is by name Dr. Damte, and he's going to help us dissect the topic preventive healthcare. This program is brought to you by CENVAS, also known as Center for Volunteerism and Social Transformation. You can follow us on our social media pages on Facebook, X, IG, and YouTube. So we will now be introduced to Dr. Damte. Dr. Damte, good evening.
Good evening, Doc.
I hope you are comfortable here.
Very comfortable. Thank you for having me.
Oh, you're welcome. You're welcome. All right. So now we are talking about preventive healthcare. I know we had a little discussion background before we came, but then can you brief us a little what preventive healthcare is? Can you expound it a little bit for our viewers to understand what we mean by preventive healthcare?
Okay. Thank you. So before I go into what preventive healthcare actually is, diseases are caused by both environmental factors. We also have genetic predispositions. We have lifestyle choices, and then other pathogens. And these issues, these factors I've talked about, go through some dynamic processes. And so they take a while before they manifest, before the individual sees or actualizes that he has the disease condition. So when we talk about preventive healthcare, all that we are trying to say is that we want to employ healthcare measures to prevent or to arrest this disease process before they start manifesting, or even if they start manifesting, how can we try and then tackle it to prevent the various disabilities that may arise and even death. So preventive healthcare is basically using healthcare measures to prevent diseases from happening. So that is it.
We know that preventive healthcare has several stages.
Sure.
We both went to medical school, so we are aware of that. So can you please explain those stages to our viewers so they understand that, maybe I am here, this is what I'm supposed to do, or I am here.
So basically we have three stages of preventive healthcare. We have what we call the primary prevention. So at the primary prevention, we are trying to prevent the disease from happening in the first place. So that involves what we are doing right now, trying to educate people. We talk to people about certain diseases, so they put in measures to prevent themselves from even getting the infections or the diseases in the first place. For instance, we educate people on the need to keep their surroundings clean, the certain gutters, sleeping under treated mosquito nets. All these are measures or educative information that we send to our clients in order to prevent them from having the diseases in the first place. Then we have the secondary prevention. So that one involves the screenings, the tests, and the various things we do. So that at the end of the day, if the person has the disease, we try to arrest it or diagnose it in the earliest forms. So that at the end of the day, even if you have it, we will try and improve on your quality of life, try to minimize disabilities, and then also prevent death from the disease. So that is the secondary, where we screen to get or to diagnose the disease in the earliest stage. Then we have the tertiary. So with the tertiary, we probably miss the primary, we miss the secondary, so the person has the disease already. So with the tertiary, what we do is how do we now manage the condition so that we can improve on your quality of life, and then if death will even occur, we'll try to help you to prolong life and then minimize the disabilities or the complications that will arise from the condition.
All right. Thank you very much, Dr. Damti. Can you give some of detailed examples of some of the measures we have put in place to help? You talked about the education part being the part of the primary, right?
Yeah.
So can you help us with some examples as to the measures that we have put in place as healthcare professionals, and then not just the healthcare professionals, even now companies are helping the healthcare professionals put some measures in place so that it's like everything is covered for their staff and for the average person.
Sure. So we have so many programs that are running to help educate, to arrest the disease or make the diagnosis earlier, and then also with the follow-ups for those who have the conditions. So what we have what we call the Health Awareness Month, where we have certain months set aside for particular conditions, so that we put a lot of information. We run so many programs in that month for the particular condition that we'll be dealing with. For instance, the month of January, which has been set for cervical cancer. So during that period, we have a lot of activities all over the world to create awareness about cervical cancer, the causes, and so many things about the condition. We also have the month of September for prostate cancer, where we talk about prostate cancer. We have series of lectures. We do other activities to market. Then we also have the month of October for breast cancer awareness.
We even had our breast cancer show last month.
Then we also have November for prematurity, and then the diabetes, exactly. I think last week we also had prematurity celebration.
Yes, I saw your pictures.
Exactly, it was a very beautiful program. I would encourage people to participate. So those are some of the programs we run. We also do what we call a community screening, where we have our people go to the communities, we engage with them, we have series of activities, we screen them on so many conditions like hypertension, diabetes, prostate, and all those diseases that I've mentioned. And then we also have the chronic follow-up clinics. For instance, if you come to our facility, we have our diabetes clinic where we run Tuesday, Wednesdays, and Thursdays. And then also we have our hypertension clinic where we invite people, those who have the conditions come for their routine checkups. We do series of investigations for them. We refill their medications, and then we educate them on how to manage the condition. So these are some of the things that we have put in place as preventive measures to help our clients.
And I would like to also make you viewers aware that he has said a lot, and it's not just his facility that has all these clinics running. Most healthcare facilities have all these things running. We have the even during the Health Awareness Month, we have certain things that we do. So if you see flyers going around, this month is for this month is for that, we encourage that you visit the hospital. Whatever it is that you need, whatever information you will be given. If you have any chronic disease, most hospitals have chronic care clinics. So when you go, the details of your disease will be explained to you. And like you said, the tertiary level, it is to prevent all these complications and then try to manage your quality of life, give you the best life that you can have even with your disease. So make sure that you are listening well. All right. So you've given us some of the specific dates that we have, the specific times that we have for all these things. We also have mental health.
Yeah,
yes,
mental health month. That is in May.
In May.
May,
yes,
yeah,
that's
sure.
That's also in May. Okay, so let's say that I'm a patient and I've come to the hospital. Okay, I heard that it's, let's say, Mental Health Awareness Month. And I've come to the clinic that, okay, I don't really understand what you mean by mental health, but I've seen a lot of flyers going around that, okay, I should take my mental health seriously and all of that. So I've come to the hospital. Can you give me like the kind of things I should expect when I come?
During
that month in particular?
Yeah, okay. So normally when we are having those celebrations, there are a series of events that we do during the week. We normally will climax it with a deba, where we'll have various heads of department or specialists in the particular field or the area that we are having the discussion. For instance, with the mental health, so you are likely to have the mental health specialists with their nurses and the other supporting staff. We have a very beautiful day bar. You also have other doctors also there. So we would normally have a presentation on the topic. So we'll talk about maybe any of the cases in mental health like depression, anxiety, bipolar, schizophrenia, and all those things. So they may likely pick one particular topic, have a presentation on it. They give you what causes, the risk factors, the management options that are available. So they will do all those presentations for you. And then also, they may also be doing screening. I mean, obviously, mental health, there isn't much screening and stuff. So, for instance, maybe if it happens to be a prostate month or something else, which they can maybe do some laboratory investigations or something to help, they may be doing those things at probably a subsidized fees for you. Or sometimes they may even do it for free. Yeah. For instance, the diabetes week celebration like this, they were checking people's random sugars and fasting sugars for free. Some were even doing glycated hemoglobin. It's very expensive, but they were doing it for free for them. So those are some of the things you get to benefit from participating in these things. You get more accurate information from the bosses themselves, and then you get opportunity to be screened for the condition as well. So those are some of the things you are likely to get.
Thank you very much. I'm sure they also sometimes get free consultations
and
counseling.
Yes.
So now that you know, I believe that once you see the flyer, just take advantage of it. Visit the facility, get a free consultation, get counseling, whatever it is you need. During those times, everything is subsidized or sometimes even free, like he said. All right. Aside this, we also advocate for yearly or biannual checkups. So can you explain to our public why we encourage them to go for checkups?
Okay, so this is a very good question. You see, from my introduction, I said that diseases are caused by you have your genetic predisposition, you have lifestyle choices, you have pathogens, and the rest. And these things don't just occur; they go through processes. So it will be prudent for you to know probably where you are. Are you at the primary? Are you just getting the infection? Or do you have a genetic predisposition to a particular disease? You wouldn't know all these things if you don't, go for these checkups. So before you see that someone has a stroke, for instance, the person just didn't get up to get a stroke. Probably this person had a long-standing hypertension or diabetes, which were not diagnosed, or even if they were diagnosed, the management wasn't well, and that is what has resulted in the stroke that you are seeing. So it is prudent that you go for these checkups so that when you go and you sit with the doctor takes you through series of events. He will start with your history, take your medical history, your surgical history, your family history, your drug history. All these information that the doctor picks, is able to put them together and then able to make a diagnosis to some extent. He may even go further to request certain laboratory or other diagnostic investigations. So after putting all these informations together, he'll be able to now tell you that this is where we are. You have the risk of maybe getting this, or you have this and that. And then at the end of the day, he's able to also come up with a treatment plan for you that is tailored towards your condition. So if you go for these checkups, you are able to get to know who you are, your level, the health status that you carry on your day-to-day. Last week or two, I read this information, this post by a lady in US. I think she said she took the son also the son had cold, and previously she wouldn't take him to the clinic. But on this particular day, she was like, no, you let me just take him there. So when he went, the doctors after examining everything, they were like, oh, he's not really, it's not something serious. It's mostly viral, so he'll be fine. They gave him some, what do you call it, hematinics and these immune boosters. Then she said something just prompted her that, okay, it's been years since I also went to the clinic. Why don't I just ask the doctor to also review me? And At the end of the day, she had leukemia. Oh yes, and it was through that particular visit the doctors were able to pick it up at a very early stage, and now she's free. So
Wow.
these are some of the things that you are likely to. We are not saying that the moment you go there means that you have a condition. Nobody knows how they are or the level that they find themselves. It is through the experts, I mean the doctors and the nurses and the laboratory people, the radio people, will be able to come up with where you are so that you'll be able to plan towards your management to prevent all these disabilities and complications you are likely to suffer later. Also, if you visit or if you come for these regular checkups, you also get to know the various, I mean, the new technological approaches that are coming up. Assuming you were having, what do you call it, malaria in the 90s or in the 80s, where they were using this, how do you call it, chloroquine to manage, and then you decide that, okay, so since then you've never had malaria until now, and now maybe you get malaria or something, you think chloroquine is the one you're going to know. You are behind time. So you get to know the new approaches in management, the various technologies that are available in caring for. So these are some of the things. And also the cost, the financial cost. Assuming this woman I mentioned about who was diagnosed with leukemia at a very early stage, the management and the treatment cost wouldn't be as much as if it was a full-blown leukemia. So you get to, I mean, financially to, you get it at a very good cost. So these are some of the benefits that I think coming. I mean, the list, they are exhaustive.
Okay. So let's say that you've gone for a checkup, okay, and then you maybe something was picked up. You are not really sure how to handle it. Are there how do you call it, counseling sessions that you can give to these people so that they know that, oh, the fact that I've had the disease, like the way you were saying, you started from primary, you went to secondary, and all of these things. Are there also counseling avenues made for counseling so that the patient knows that, oh, this is not just me, I'm not the only person suffering this, and that I have, help from here, help from here, help from that.
Okay, so when we make diagnosis as doctors for any condition, when it comes to the management, people think that once you go to see the doctor or once the doctor makes a diagnosis, straightforward, you are put on medications. No, it doesn't work like that. Our management, we have what we call the non-pharmacological management approach. And then we also have our pharmacological. So the non-pharmacological, you are not dealing with drugs or anything. And then we have the pharmacological. So it's not always that we are dealing with the pharmacological. Most of the time, we would prefer using the non-pharmacological approach.
True. And a lot of patients will not believe when we say most of the time we prefer non-pharmacological.
Yeah,
they think our aim is, yes, we need to get a diagnosis, yes, we
get
need to
medications and then go
ourselves.
exactly.
No, that is not the plan.
That is not. No.
Honestly, we wish that you people are always helping you. Come, you tell us how. Oh, this method worked for you without the medication and all of that.
Exactly. So, and the non-pharmacological approach also involve the use of these counselors, peer groups, even the churches, the what do you call it, various associations, these keep fit clubs, the dietary counseling, and all these things. So it doesn't necessarily mean that if we make a diagnosis of a particular condition, automatically you need to go for medications. No, no. So we will tailor your management towards, I mean, it's individual. So per what you are diagnosed of, and then what we think will be good for you. And the management is not one way. We sit with you. Do you get me? So we discuss what we think is okay for you. You also make your input. So at the end of the day, we come together to agree on the management for you. Not that the doctor will impose.
No. That is not why we are here.
No.
That is not why we are here. I wanted to ask, you know how patients sometimes they behave when you refer them to another, person to talk to them. I found out through my very short practice that there are some of the disciplines that the patients always think, oh, they know better, they've heard this from here, especially when it comes to their nutrition. When you refer patients to a nutritionist or a dietitian or something like that, it's like they don't see how important it is in our management for them. So can you please give us like maybe a case you had, maybe the kind of you referred probably to a dietitian, and then how even just the diet management helps the patients. I have a lot, so I'll also share an example, but
Oh yeah,
you can go
yeah.
first.
So it reminds me of when I was in school. One of our professors used to tell us that a good doctor is the one who knows when to refer. And referring is not necessarily to your bosses or no, when to refer and then to which department or to which who you are referring to. So most of the time, for instance, in the diabetes and the hypertensive clinics, they come and then after everything, they're like, doctor, so what kind of food can I eat and stuff? And I'll be like, no, for this one, you need to see a dietitian or a nutritionist because that is their field. In the hospital, we have different people there doing different jobs. We all went to different schools. Our trainings are different. So what the dietitian will be able, the kind of information he or she will be able to deliver to you. I'm sorry, I will not be in that position to do that. So when we are referring you to see someone, it doesn't mean one that we don't know our work or we cannot help you or like we are inferior and we are no. It's because probably the expertise that this person will be able to deliver. I'm not at that level yet because our trainings are different. So that one we have almost every day you meet them when you are they'll be like, nah, who is that person? Is that person also a doctor? No, he or she doesn't need to be a doctor to be able to
give you the right
exactly. So that's basically what.
I would also like to add that the fact that we are referring to another department even goes on to show how much the doctor really cares about your complete well-being. Because I mean, we could have just given you medication, and then whatever symptoms you brought will just go away. But that doesn't mean that whatever started the disease process has been completely cut off. Because medications treat the symptoms. Sometimes if it's an infection, they treat the disease. But there's always, like you said, there are always several factors that cause the disease. And it's not just one part we are directed at. We always have to go make sure all the factors that causing the disease are being addressed. All right. So before we end this session for today, do you have any final comments for your viewers? Any advice?
Yeah. As for the advice, I have a lot. if you will give me the permission, I think.
Please give them everything.
So
we all need
number one is this condition, hypertension, the silent killer. I always say we may be walking about with this condition, but because it rarely gives you the signs and symptoms before you are diagnosed or before it's fully blown. That means you are at the peak of it. And making a diagnosis of hypertension isn't anything difficult. And getting you to know your BP level doesn't cost much. I always say that the very wicked pharmacies around, they charge 1 cedi.
Yes.
Others charge 50%. Some don't charge at all. And then you get there, they give you seats, just 5-10 minutes. They do it for you, and it doesn't even take up to a minute or two to know your BP.
And it is not painful.
And it is not painful. So please, especially if you are 40 years and above, walk into any pharmacy around. If you can't go to the hospital for a routine checkup that we are encouraging, at least walk into any pharmacy around. Tell whoever is there, beg him or her, that please, can you check my BP for me? After checking, ask them, how high or low is it? They will advise you if you need to quickly see a doctor. They will advise you to do that. And it doesn't cost and it's not painful and it's easy and accessible to do that. So that is one. And then another thing that we don't normally talk about is prostate in men. It's very common, especially in the blacks, Africa, people of African origin. So I would also encourage any man watching us that that please, at least once a year, visit any hospital, let them check your PSA level, and then advise you accordingly. Then to our women, breast examination.
Exactly.
Yeah, breast cancer is also on the rise, and I will also encourage them. It's also free, non-invasive. It doesn't cost any. It's some few minutes of your time that they will spend to. If you don't know, that is if you don't know how to do the self breast examination. So you can visit any facility and let them at least once a year. That will also help. So for now, let me end here, or else I'll talk.
Yes, and I'd also like to reiterate that we advise you to get a checkup yearly or twice every year. You see, there are lots of conditions he has mentioned. Personally, the number of young people I have encountered this year alone, who have come in with diabetes, who have come in with very bad cholesterol levels. And these days, it's like when you advise our young people, it's, well, I'm not old, but then when you're advising them, you are telling them because you know as a doctor how bad some of these simple things they call simple can get to. It's like, oh, you are telling them they shouldn't enjoy in life. Someone actually told me that, hey, now when you're never enjoying, now you are telling us to just stop.
Someone even told me, doctor, today is Friday and you are advising me. Who takes advices on Fridays?
Can you imagine? Really? So, see, the honest truth is that most times, like you said, you might not even have any genetic factor causing your disease. It is entirely you and the choices you made. And sometimes you can say, oh, you are blaming your parents when you were a child, but come on, at a point in your life, you decide to make your own choices.
Exactly.
So I'll advise you, once you've chosen to eat this, eat that, you, they're fine. If you won't take our advice about the food, take our advice about the frequent checkup. Anything can be picked up very early before it gets to full-blown symptoms. Like you said, a lot of hypertensive cases who come in with stroke, it can be prevented. It could have been prevented. But then because they didn't do their frequent checkup, they didn't get their BPs checked frequently, they come in and they have a full-blown stroke. Some survive the stroke fine. Others come with a whole lot of complications after the stroke, kidney failure, they come with parts of their bodies paralyzed. Others don't even recover at all, and then they go on. So please, we are advising and advocating for frequent checkups. Preventive healthcare is the topic we brought to you today, and Dr. Damsey has done a wonderful job dissecting it. I believe wherever you are clapping for him right now. So before we go off, we'd like to say thank you once again for joining us for today's show. And we are saying continue following us on our social media pages on Facebook, on X, on IG, and on YouTube. This program was brought to you by CENVAS, Center for Volunteerism and Social Transformation. Have a wonderful evening. And as usual, your host, Dr. Araba Aso-Odum. See you same time next week. Bye.
Watch TV, promoting sustainable development.